Good evening, everyone. Hope you guys are doing well. I am Paridhi Jain, and I am co-founder of PRASHA organization and host for your evening. First of all, thank you so much, guys, for coming on a Saturday evening. It shows your excitement for knowing more about mental health. And I just want to mention that this is the first mental health webinar for our mental health project for PRASHA, and we have many more events coming up for the upcoming year. Also, I would like to thank our speakers for today, Mrs. Ranjna Pardasani and Miss Aditi Jain for agreeing to sharing their wisdom to us. I would without any further ado, let's start the session, and we'll starting with our first session, which is understanding the mind and body connection. Forwarding it to you, ma'am.
Good evening, everyone. Am I audible?
Yes, ma'am, you are.
Paridhi, am I audible? Okay. Good evening, everyone. You young, enthusiastic future doctors. And it's happy to know that you are interested in learning about mind-body connection and psychology of human beings and your patients. You are going to treat your patient's body, but body cannot be separated from mind. Understanding mind is an essential element of treating the body. For your treatment to be effective, you need to understand your patient's psychology. So congratulate yourself that you have taken this step to understand your patient's behavior, patient's mind, so that your treatment becomes effective. Now, when we talk about mind-body connection, this topic has been focus of my workshops and training since last 7 years. Though I am in teaching and training since last 20 years, but 7 years back I was diagnosed with cancer. So I have researched for answers to some of the toughest health questions. And what I have found and what I have implemented in my life has radically transformed my life. So, this mind body connection is not just a concept for me, it's the thing which I have lived, it's the thing which I have felt, it's the thing which I have experienced. And what I have learned through this, what I have learned through this experience about this topic is what
Is there some glitch? Can somebody look into it?
Yes, I'm on it. Just a minute.
Now, am I visible?
Yes, ma'am, your screen is visible.
And PPT is also visible?
Yes, you can just increase this, like open it. Yes, it is now.
Yes. Okay. So I was talking about through my experience about cancer treatment and all that. What I have come through is that our mind can make us sick and it can make us well as well. So our thoughts are so powerful that just by thinking we can be sick, or just by thinking we can be well. Right now, suppose I don't have any headache, but if I continuously say that I am having headache, I am not feeling well, I am having headache, actually I will get the headache. So thoughts are so powerful. Another thing which I have learned is our feelings and beliefs impact our every cell. Every thought, every emotion has some or the other chemical reaction in our body. If I am having positive thoughts, so that is triggering the positive chemicals or hormones in the body. If I am having negative thoughts and negative emotions, then stress hormones are releasing in my body. So every thought, every emotion has some or the other chemical reaction in the body. And how we speak to ourselves, that matters a lot. Our self talk, what I'm talking to myself, that also affects the release of those chemicals, positive or negative, depending on what I'm talking to myself. Then our thoughts hold more medicine than many of the astonishing breakthroughs of our time. So if we talk about health, the key to health isn't just eating nutritious food or exercising daily or getting 8 hours of sleep or maintaining healthy diet and taking our vitamins, though all these parameters are very important for optimizing health. But one of the things is more important than all these is our thoughts. We have power to heal the body just by changing how we think and how we feel. Now, let me tell you this very frankly, that doctors don't discuss this possibility that thoughts can affect our body. They don't discuss this possibility in front of patients. But they do whisper about it in doctors' lounges in hospitals and inside the conference rooms of Ivy League universities. If you are curious, my dear students, and if you pay attention, you will hear stories. You will hear stories, though, that will blow your mind. If you are curious, you are attentive, then you will hear about people whispering about people, about the woman whose cancer shrank to nothingness during the radiation. Only afterwards, doctor discovered that the radiation machine was not working and she didn't receive radiation, but she believed she had received. And that belief changed everything. That belief healed her. And you will also hear stories about a man with blocked coronary arteries diagnosed after a heart attack and was told he would die within a year if he didn't have heart surgery. After refusing surgery, he lived 20 more years and died at 92, and not from heart disease. We all know. You must have read about that. You must have heard about that. There are spontaneous, unexplainable remissions which sometimes happen. Every doctor has witnessed this, and you will also witness in your life. But doctors can't explain remission with logic. And the more you listen about such stories, the more you start to wonder just what the body is capable of. Now, most doctors, if you get them away from their often critical and judgmental colleagues, will admit this. Deep down, they believe that when it comes to healing, when it comes to treatment, there is crossover between faith and medicine. And the common ground that connect the two is great, powerful mind. But doctors don't say this out loud for the fear of being uh, labeled as quacks or fraud or ignorant. So mind-body link has been advocated by many medical pioneers for decades. Yet in spite of all this, this concept has failed to enter the mainstream medical community. Renowned physicians, you must have heard their name, Dr. Bernie Siegel, Dr. Deepak Chopra, they have raised awareness about mind-body link, but their teachings have not been included in medical education. The books of these open-minded doctors are not required reading for medical students. So there are some shocking stories which I will tell you, shocking truths which I will tell you about this mind-body connection. There was a 1957 case study by Dr. Bruno Kloffer. Now listen to this very carefully. This is just, you can say, magical healing which happened to this patient. So this 1957 case study by Dr. Bruno Kloffer reports the story of Dr. Philip West and his patient, Mr. Wright. Now, Dr. West was treating Mr. Wright, who had an advanced cancer, and all treatments had failed and time was running out. Mr. Wright's neck, chest, abdomen, armpits were filled with tumors which were of size of orange. Now, Dr. West didn't expect him to last a week. But Mr. Wright desperately wanted to live, and he hung his hope on a promising new drug called crabiozin. He begged his doctor to treat him with new drug, but the drug was only being offered in clinical trials to people who were believed to have at least 3 months left to live. And Mr. Wright was too sick to qualify for this. But Mr. Wright didn't give up. Knowing the drug existed and believing the drug would be his miracle cure, he pestered his doctor until Dr. West reluctantly gave in and injected him with crabiozin. Dr. West performed this procedure on Friday, but deep down, he didn't believe Mr. Wright would last the weekend. Now, to his utter shock, the following Monday, Dr. West found Mr. Wright walking around out of bed. According to Dr. Kloffer, Mr. Wright's tumor masses had melted like a snowball on hot stove and were half their original size. 10 days after the first dose of crabiozin, Mr. Wright left the hospital apparently cancer-free. Now, Mr. Wright was very happy and praising crabiozin as a miracle drug for 2 months, until the scientific literature began reporting that crabiozin didn't seem to be effective. Mr. Wright, who trusted what he read in the literature, fell into a deep depression, and his cancer came back. This time, doctor who genuinely wanted to help save his patient decided to get sneaky. He told the patient that some of the initial supplies of the drug had deteriorated during shipping, making them less effective, but that he had scored a new batch of highly concentrated ultra pure crabiozin, which he could give him. Of course, this was a lie. Dr. West injected Mr. Wright with distilled water, just distilled water. And a seemingly miraculous thing happened again. The tumors melted away. And Mr. Wright was feeling great again for another few months. Then again, the American Medical Association blew it by announcing that a nationwide study of crabiozin proved that drug was utterly worthless. This time, Mr. Wright lost all faith in the treatment. His cancer came right back and he died within 2 days. Within 2 days. So this is power of belief. When I read this case study, it just blew my mind. Our thoughts are so powerful. They can make us sick or they can make us well. This is power of belief. This is power of thought, which you have to use in favor of your patients, in favor of your treatment. There is one more study which was published in New England Journal by Bruce Mosley. He was orthopedic surgeon, renowned for surgeries he performed on people with debilitating knee pain. Now, what study he did, he made two groups of surgery patients. The patients in one group of the study got Dr. Mosley's famous surgery. The other group of patients underwent an elaborately crafted sham surgery, fake surgery, during which this fake surgery, the patient was sedated, 3 incisions were made in the same location as in real surgery, and the patient was shown a pre-recorded tape of someone else's surgery on the video monitor. Then after surgery, doctor sewed the knee back up. As expected, 1/3 of the patients getting the real surgery experienced resolution of their knee pain. But what really shocked the researchers was that those getting the sham surgery, those getting the fake surgery had the same result. Now, this study of Dr. Mosley was published in one of the most highly respected medical journal in the whole world. Now, this showed the power of belief. Because patient believed that they are getting surgery from one of the famous doctor, so their knee pain was relieved. This is the evidence that a belief could alleviate a real concrete symptom in the body. Just a belief, just a thought can treat anything. So you must have heard about placebo. What is placebo? You must have heard placebo is a treatment where there is no real drug. No real drug with the medicinal property is not there. Only a sugar pill or saline injections are used. So there are many clinical trials where a person who has taken the placebo instead of active treatment has reported an improvement in symptoms. So what is explanation behind that? Why people in clinical trial get better when they are treated with nothing but a sugar pill? So there are many explanations for that. First is mind can affect the body. Patients' belief in treatment is enough to change the illness. Positive beliefs, as I said, can heal the body. Belief that you will feel differently leads you to feel differently. Because patients in these clinical trials, they expect to get well, so they get well. Their expectation, their thoughts, their belief changes everything. And another explanation is about why people get better by taking sugar pill is they believe in the power of modern medicine and expect to feel relief when they see doctor whom they trust. They are used to getting a real drug from a person in a white coat. That white coat gives the authority, that gives the credibility, and subsequently the patient gets better. They have become so conditioned to feel better by receiving a drug from someone in a white coat, even if it is a sugar pill. So mind is working its magic before the therapeutic encounter has actually happened. And third explanation for this is patients participating in clinical trials receive emotional support, attention, nurturing care, healing touch of respected authority figures in white coat. And we all, we all want to feel seen, heard, loved, and this alone may relieve symptoms. This emotional support which a patient gets relieves the symptoms and stimulate the positive physiological changes. So we can say doctor himself or herself is acting as a medicine. Ted Kapchuk, who is director of Harvard's program in placebo studies and therapeutic encounters, said in an interview that in clinical trials, a sugar pill doesn't do anything. What does something is the context of healing. It's the ritual of healing. It's being in the healing relationship, which is between doctor and patient. That is healing the patient. Patients are healed not only by medicine, but also by medical care. Caring, nurturing attitude of doctor. This care, empathy, sympathy shown by doctor is important factor which helps in healing along with medicine. So huge part of the placebo effects revolves around the delivery of nurturing care by the doctor. But one important thing is lack of loving care also elicit opposite effect, which is called nocebo. Opposite of placebo is nocebo. Placebo is power of positive thinking. Placebo is power of expectation, hope, nurturing care. And nocebo is power of negative thinking. If positive belief combined with nurturing care of doctor can heal the body, then negative belief and harsh care, harsh comments from an insensitive doctor can harm the body. Now, for example, in a clinical trial, if you tell a patient they will be given a pill that will relieve their pain, there is a good chance the pain will go away, even if they are given a sugar pill. But if you warn them that the treatment might cause nausea and vomiting, and then there is a high likelihood that they will puke, even when they never got the real drug. Now, the very famous doctor, you must have heard his name, Dr. Bernie Siegel, and his book is also very famous, Love, Medicine and Miracles. So in that book, he cites one study showing that cancer patients who were undergoing treatment through new chemotherapy drug were given nothing but saline water. But patients who were under treatment, they were under impression that they are getting chemotherapy drug. Actually, they were getting saline water. And we all know the side effect of chemotherapy is hair loss. And patients were under impression that they are getting chemotherapy drug. So 30% of patients lost their hair just by saline water. So this is power of nocebo. Think sick and be sick. In another study, hospitalized patients were given sugar water and told it would make them throw up. And 80% of them vomited. So this is again power of negative thought, negative beliefs. So one more fascinating case study described by a psychiatric patient, by a doctor about a psychiatric patient who had a split personality. And as one personality, the patient was not diabetic. You must be aware about multiple personality disorder, one person having multiple personalities. So as a one personality, the patient was not diabetic and her blood sugar levels were just normal. However, the moment she entered another personality, she believed she was diabetic and she literally became diabetic. Her entire physiology changed. Her blood sugar rose, and from all medical evidence, she was in fact diabetic. When her personality flipped back, her blood sugar returned to normal. Again, this is power of thought. She believed that she was diabetic, so her blood sugar level raised. Psychiatrist Bennett Brown, who is author of Treatment of Multiple Personality Disorder, describes several similar cases. One case he told is about one patient who was Timmy, who had multiple personality disorder. In one of his personality, when he drank orange juice, there was no negative consequence. But when he entered another personality, which was allergic to orange juice, he breaks out into blisters at the slightest sip of orange. If, however, he comes back in the midst of an allergic reaction to original personality, blisters instantly resolve. Water-filled blisters begin to subside. What is all this? All this is power of placebo and power of nocebo. Nocebo can result in sickness and even death when the patient expects such an outcome. And what doctors suggest, that also, as I told you, makes a lot of difference. So the suggestions by doctors or others are called heterosuggestions. Heterosuggestions are very powerful. Suggestions given by others are very powerful. Now there is one more interesting case study which I will tell you. Dr. Lawrence Egbert conducted a study at Harvard Medical School, and this was published in New England Journal of Medicine. Now for this study, he divided surgical patients into two groups. And both the patients in both the groups were getting same surgery, hospital was same, doctors were same, and anesthesiologist was also same for both the groups. But only one difference was there. One group met with cheerful, optimistic anesthesiologist who assured the patient, surgery patient, that their surgery is pain-free. It is going to be like a piece of cake. They are going to be very comfortable and everything is going to be very fine and they will be discharged soon from the hospital. So these were positive comments given by the anesthesiologist to the group 1. Other unfortunate group 2 were attended by same anesthesiologist, but who was instructed to behave differently with another group. To group 2 patients, he said he was grumpy and he was rushed and he was unsympathetic, and he said surgery is going to be very difficult. Your surgery is major and you need to take care of yourself after surgery, and it might take 8 to 10 days to get discharged from this hospital. Now it's easy to guess for you which group must have recovered faster and which group was discharged early. Those who got the optimistic anesthesiologist required only half the amount of pain-killing medication and were discharged earlier than other group. So optimism on part of doctor makes a difference, makes a lot of difference. Patient's recovery could be increased by words which doctor use, words which you will use. Positive words can lead to fast recovery. On the flip side, negative words lead to longer recovery period. So doctor himself or herself is placebo. Doctor is the placebo. So you all are going to be placebo for your patient. While optimism and positive words are key, but trust is just as important. Trust from patient side. Nocebo effects can occur when a patient's distrust medical personnel. So personality of doctor matters and trust from the patient sides also matters. Personality of doctor makes a lot of difference. A Harvard Medical School study demonstrated that the response to a placebo increased from 44% to 62% when the doctor treated the patient with warmth, attention, and confidence. So healing touch makes a lot of difference. Now, this is one story which I am going to tell you, real story, which will show the power of psychological factors on physical health. This is story of Norman Cousin. Norman Cousin was an American political journalist. In 1964, he went to Russia to cover some news. The trip was very stressful. When he returned back to America, he was diagnosed with degenerative spondylitis. He was in constant pain. He was unable to move his body. He had high fever and he had near paralysis of legs, neck, and back. Doctor said he would die within few months, and doctor told him that he had one chance in 500 of recovery. And doctor gave up on him. After the doctors gave up hope, he took charge of himself. He disagreed with doctors and reasoned that if stress had somehow contributed to his illness, because he was not sick before the trip of Russia. So if stress is reason for his illness, then the positive emotions should help him feel better. This was his reasoning. Stress can create illness, then positive emotions can heal me. So he checked himself out of the hospital and into a hotel across the street and developed his own treatment plan. He began taking high doses of vitamin C to strengthen the immune system. And he had self-induced bouts of laughter. How? He persuaded his wife to read him humorous columns, stories, articles from newspaper, magazine, and storybooks, and he watched comedy movies and cartoons. Now, 10 minutes of genuine belly laughter had an anesthetic effect, pain-killing effect. He lived for 35 more years. He later wrote a book, Anatomy of Illness. And in his experience, which he wrote in this book, he said, 10 minutes of belly laughter would give me at least 2 hours of pain-free sleep. And when the pain-killing effect of the laughter wore off, we would switch on the motion picture projector again, and it would lead to another pain-free interval. This is how he treated himself and lived for 35 more years. We know laughter increases release of endorphin, which is natural painkiller. Laughter also alters dopamine and serotonin activity, which are natural feel-good hormones, and that improves the overall sense of happiness temporarily maybe, and it relieves our pain temporarily also. So, as I said initially, that positive emotions, positive thoughts help us to release positive hormones and chemicals in the body. And negative emotions, negative thoughts releases negative hormones, stress hormones in the body. So we need to keep check on our thoughts and our emotions. And we also should, as a doctor, you should help your patient to keep check on thoughts and emotions, because each and every thought, each and every emotion is having some or the other chemical reaction in our body. So help your patients to keep check on that. So there is one more study which I would like to share. For that study, first you should know the difference between 3 types of ages. One is chronological age, another is biological age, and third one is psychological age. Chronological age is easy to understand. We all know our calendar age, that is our chronological age, which is fixed. Though it is fixed, but it is most unreliable of the 3, because 150-year-old may be nearly as healthy as any 25-year-old, while another 50-year-old may be, or his body may be 60 or 70-year-old. And biological age tells us how time has affected our organs and tissues compared to other people of that chronological age. And biological age is changeable. We all know biological is changeable through physical exercise. And what is psychological age? It is how young you feel. If I am right now 54-year-old, but my psychological age may be around 30 years or 25 years, I feel that I am 25-year-old or 30-year-old. So this psychological age is more flexible. It's completely personal. Now, one experiment which was, as I was saying, conducted by Alan Langer, and on the basis of his study, she has written a book, Counterclockwise. In this book, she has explained about this experiment or this study, and this study shows that aging can be altered. It can be reversed to a certain extent. Now, this experiment was conducted in 1979. The subjects or the participants of study were 75-year-old and were asked to meet for a week's retreat at a resort. They were informed in advance some physical and mental tests would be conducted. One unusual condition was placed upon them. They were not allowed to bring any newspaper, magazine, book, or family photo dated later than 1959. The resort had been set up to duplicate as if it was 20 years earlier. Instead of magazines from 1979, the reading tables held issues magazines from 1959, 20-year-old magazines and books. The only music played was 20 years old. The men were asked to behave entirely as if the year was 1959. All talk had to refer to events and people of that year, that is 1959. Everything in that resort was said to make each participant feel, look, talk, and behave as if they were in their mid-50s. The participant wore ID photos taken 20 years before. They were instructed to talk exclusively in the present tense of 1959. The Harvard team, which conducted this experiment, they wanted to change the context in which these men saw themselves. The premise of this experiment was that seeing oneself as old or young directly influences the aging process itself. Now, the result of this experiment was remarkable. After the week's retreat, again their physical and mental checkup was done, and those checkups showed that their memory improved. Their manual dexterity improved. They were more active and self-sufficient about such things as taking their own food at meals and cleaning up their rooms. And surprisingly, their face looked visibly younger by an average of 3 years. The measurement of their fingers, the length, finger length, which tend to shorten with age, that had lengthened. Their stiffened joints were more flexible and their posture has become straight. Their muscle strength, as measured by the hand grip, improved. Their hearing, their vision also improved. Now, this study by Alan Langer is very important, is landmark in proving that irreversible signs of aging can be reversed using psychological intervention. That means what we think that we are. If I think I am old, I am not able to do this or that, then I won't be able to do. But if I think young, then I will feel young, then I will act young. Now, why all these changes happened to these subjects of this study? Because they were asked to behave as if they were young. Because they were treated as if they had intelligence and independence of younger people, unlike the way they were often treated at home. So this again is power of thought. This again is power of our belief. What we believe, we become that. What we think, we become that. And if I share my experience in short, how I have applied this to my life when I was going through chemotherapy, then I used the power of visualization, creative visualization. I used to first go in deep meditation and think about that my cancer cells, which are of black color, and my white blood cells, which are of white color. White blood cells are growing in size and cancer cells are decreasing in size. Just this visualization. So I am saying this in 2 lines only, but this visualization helped a lot in my treatment. I didn't have any side effect of chemotherapy except hair fall. Otherwise, when we go for a chemotherapy, doctors give a long list of side effects. This might happen, this might happen, this might happen. At least 8 to 10 side effect doctor told me. But you can say through power of visualization, I was able to heal myself and didn't have any side effect except hair fall. The power of mind, power of thought, power of belief plays an important role in our treatment. Okay, though this topic is like unending, I can speak on and on and on this topic, but because time is limited, so from my side for today, it's where I want to stop. Yes, Paridhi.
Thank you so much, ma'am, for sharing your views. Do you guys have any questions you can ask, ma'am? It would be great if you can answer some questions.
If there is no question answer session tomorrow also we can start with Aditi's session today.
I have a question, please. Do you hear me?
Hello.
Do you hear me?
Yes.
You mentioned that the guy was using a high level of vitamin C in order to heal himself, but it also has toxicity. And the other question is how we can stop negative thoughts that we are believing them. How can we change that believing?
So how to stop negative thoughts? Now that is different domain. There are many techniques. One is mindfulness. Another is cognitive behavior therapy, which can be mindfulness is a meditation in which we learn to live in the present. Generally, thoughts which we have, which are disturbing, are about past or about future. Either we are thinking about the past mistake which we have done, we have guilt about that, or we are sad about that, or we are anxious about the future. What will happen in the future, and we are not living in the present. So those negative thoughts affect us. So mindfulness helps us to live in the present. So if you learn mindfulness, then you will be able to control negative thinking. And another way, as I said, is cognitive behavior therapy, in which we learn to negate our negative thoughts, why we are having negative thoughts, and what opposite, that is what positive thoughts which we can have instead of that. So again, this is a therapy approach which you can get from any counselor.
Thank you.
Mm.
I think that's all. Ranjana ma'am, I would like to read out one comment that somebody did. I think Webhub did in the comment section. And he's writing, ma'am, I can hear you all day. You are incredibly motivating and energizing. Thank you so much for this session. And
Thank you.
Yeah, and I think it would be right for me to say it on the behalf of everybody else that, yeah, we all can listen to you entire day. And there is so much that we got to know. It was almost enlightening.
Thank you.
Right. No, don't confuse me with Paridhi or anybody else. I'm not the host of the session. I'm your next speaker, Aditi. And I can see there are some 100 doctors with us today, upcoming doctors. I again welcome you all. And I can also see doctors from too many countries. And it's good to be on a platform where we can share, learn, and talk to people from all around the world.